Welcome back to our topic, dental caries in children or tooth decay in children. It's the time that you can interact with us with your questions. The number to call is 0808 054 2233. That's 0808 054 2233. And if your tweet's coming in time, they could be treated. We were talking about the toothbrush. Big handle, small mouth because of the size of the child. But I noticed that some of them have really spaced out bristles. Is that deliberate?
Well, don't forget that we have different manufacturers. And then I would say that our conventional toothbrush actually will do fine. Now, when you have the designed, in quotes, bristles, some of them are actually intended to go into the interdental spaces, that in between the teeth, and also to follow the gum line, to clean off the gum line. And then some of them have these small heads that allows you access to the back teeth, which we hardly don't clean well. Now, for children, I don't expect a child that is less than 6 or even 7 to be brushing by himself.
So
they
what
need
do
to
we
be.
do?
They need to be supervised.
Birth to 6 or
Yes.
birth to 7?
Yes, they need to be supervised. Because they
the
don't
mothers are going to work now.
That's where we have the problem.
So what's to be done for these children?
Well, that's a major one. But we always say it's not just the mother that is involved in training these children. If you have a caregiver, I mean, or someone who takes care of them, you can actually explain and teach them how to go about it and make sure that they are the ones doing it. Some of these children, don't forget that they like to do it by themselves.
On their own, yes.
Yes, so sometimes we encourage it, but you have to be there. I remember there was one time an advert I used to like way back then, Max and Oliver. Daddy is brushing and the child is also brushing. The father actually allowed the child to brush while he is brushing. So it's the way we teach them and they get used to it that matters.
All right. Now, what could be the implications of dental caries that have been left too long? What's the implication going further for the child?
Okay. When you have dental caries that is not managed, it's cavitated, you have it like the picture I showed, the patient presents and you don't do it for those that don't come to the clinic. From the enamel, it goes to dentin. Dentin straight down into the pulp. That's the living tissue of the mouth.
Okay. Enamel to dentin.
Yes.
We have a little mouth here. Can you show me what you mean when you say enamel?
Actually, all these are the enamel. The dentin is underneath.
Outside?
Outside, yes.
Okay.
Dentin is underneath, the second layer after the enamel. Okay. And then after then, it goes straight down into the pulpal tissue.
So the pulp is like in the root.
In the root, from
the mouth.
part of the enamel and then part into the roots. And it keeps going down. Of course, it's an infection. Now think of all this area. It's living tissue. You start having inflammation. And then by this time, the child is already in pain. If left, then they start having infection of this whole area.
That's what you call the gingivitis?
That gingivitis is something else. Okay. But by now, they are actually developing an abscess, like a swelling.
And the pain is
getting worse. And gradually, if it's still not left, it goes into the bone, straight down, and you're talking about osteomyelitis and something much more serious.
Can it get to the brain?
Yes, we've had a case or two. At least I've read of a case or two where a child, they reported brain abscess, and it was secondary to dental caries.
Brain abscess?
Yes, brain abscess.
What's the implication of that? Do they have to begin to drain something out of the brain?
Yes, something that's more serious, yes.
So if the child complains, there's pain in my tooth, yes. Somebody needs to act fast?
Yes. In fact, I think before they start complaining, many of us actually notice that these children have issues, but we just take it lightly. Once you notice that there's something not usual from your child's dentition, I think you should just take the child to the dentist.
Let's take Olumide from Ibadan. Hello, Olumide. Oh, we've lost Olumide. Please try again, Olumide, for your question. Okay, so it can be as bad as that.
If left, yes.
And is this the reason why some children are being told they are not brilliant? They don't have any sense? Because I can imagine a child going through that kind of pain is probably not thinking in class.
Yes. Now, one of the effects of dental caries is, like I said, pain. it limits their quality of life. Imagine a child that is in pain. It won't be interested, or even if he wants to learn in class, it won't be able to. Then they don't play, because they are in pain. They sit down somewhere, and then even when they want to sleep, they sleep in a postural position, meaning maybe this part
they are
of
favoring the painful area.
They are not. They are trying to avoid the painful area.
Okay.
And then they have to miss school classes. Maybe they write in school that this boy is in pain. The mom has to withdraw the child, and that's when the whole story starts. They bring to dentists, but by then, something that can be prevented, because dental caries can be prevented. But by the time they are coming down with pain.
Are there some types too that don't have any pain? There's caries, but there's no pain.
If it's caught on time, that's if they present early to us, yes, it can be stopped.
Okay.
The pain.
That's another area we're going to. If somebody has dental caries,
yes,
can you actually stop it from progressing?
Yes. We have different forms of managing such cases. One of the things that we tell mothers also about prevention is using fluoridated toothpaste. As simple as it sounds, just using toothpaste, it goes a very long way.
It seems as if every toothpaste has fluoride now.
Not every. If you look for some toothpastes around don't have fluoride. So usually when you want to buy toothpaste, just check the back. You know whether it's non-fluoridated or fluoride.
So what does this fluoride do?
Now fluoride actually, for children, makes the teeth, in layman's terms, makes the teeth stronger. Then it also stops the production of acid from the bacteria. That means altering their habit. Yeah, it's the acid.
It attacks the acid.
Exactly. So it prevents the bacteria from producing acid. And then once you have that, the whole progression stops. Now, one of the things we do in the clinic is we have this fluoride in concentrated volumes, and then we apply it professionally. And then also tell parents at home that use fluoridated toothpaste and then learn to brush at night. Because I tell people twice daily, many people brush in the morning, but it's the night part that is the most difficult and is actually one of the most effective. The last thing at night will save a lot of story, because imagine a child that came back from school, ate sweets, ate chocolate, ate meat pie, and then you brush up everything. It's not going to take it over. And don't forget that when we sleep, salivary flow is reduced, meaning that you are leaving that part of cakes on the tooth, because once saliva doesn't clean out the sweets, it's left just there. And then that's when bacteria can really initiate degradation.
But if a child already has caries, though,
yes,
can this progression be reversed now?
It depends on to which level.
What I mean is this.
Yes.
Can the caries disappear? He already has caries,
in the early stages.
So that thing is true.
Yes, in the early stages, it causes, once you stop the habits, and then you start using fluoridated toothpaste, it causes the fluoride causes a remineralization of the tooth substance.
Oh, so fluoride is really good.
Yes, but that is in the early stages. Once you start having cavitations, you have to restore professionally in the dental clinic.
And that means fillings.
Fillings, yeah, there are different types.
Now, if you look at these teeth, I really wanted to ask you this.
Okay.
They have some depressions in the center.
Yes.
Are those supposed to be there? Because food gets there and you have to keep picking it out. It's irritating.
When you're picking out, it may be that there's already a cavity there. But if it's just that the grooves on the tooth, it's normal.
Okay.
But some children have deeper grooves, and what we do is we block it out.
Okay, let's quickly take Rosalind before we continue. Hello, Rosalind. Hello, Rosalind, are you there? Rosalind is not getting through. So you said some are deeper than they should be.
Yes.
So you even it out.
Yes.
But the groove is natural. It's
yes,
supposed
it grooves.
to be there.
Yes.
Now, what would you tell parents to do for their children's diet? That's another area.
Actually, the key to preventing dental caries lies more on the caregiver and the mother, particularly the mother, because mothers are considered as the primary caregiver. Now, what I tell them is watch their diet. These children consume this cariogenic substance every day. Like I told you, I gave you an example of that actually happens to many children. They take
Sugar-coated
cereal,
cookies.
exactly, cereal in the morning when they're going. Don't forget your biscuits. Don't forget to take your juice. Don't forget this. I'm not saying you cannot tell a child to stop, outrightly stop cakes, and no, that would like be like punishment. What we do is modify it. Let them have this habit of, okay, on Mondays I eat cakes and sweets. On Tuesdays is fruits. That's natural fruits. I'm talking about apples, bananas. And then Wednesdays, they take something else. And then you can just break it down rather than give them every day. Once they get into the habit of knowing it is not an everyday affair to take biscuits to school,
they get
used to it.
Okay, so Dick, is this okay? Olayinka says my daughter's primary teeth came out more than 2 months ago. Till now, they are not growing back. What can we do, and what is the reason? Is that normal?
Well, it depends on the daughter's age, actually. I wish you put
the age of
there.
the daughter.
But if the daughter is around from 5 to 6, usually it's nothing to worry about. You should just calm down. And then I don't know how the tooth was lost. If it was due to trauma or it came out naturally.
In a word, Olayinka, please see the dentist with your daughter. Okay. That's all we can take for today. Thanks so much for coming.
You're welcome.
Thank you for being with us, and thanks for your tweets. They came in a bit late, but next time let's try harder. Have a great day. I am Mary Alale Yusuf.